And at the same time, the U.S. Senate is debating a bill that could improve how our country handles the issue of mental health. I sat down with Republican Bill Cassidy from Louisiana about why, for him, this isn't only about policy, it's personal.
Every single one of us has a family history, a loved one, a friend, someone you know that has serious mental illness. If you add addiction to that, it becomes even more pervasive. Now, that's my family too. And everybody watching, it's their family.
When you say your family, how so?
Oh my gosh, don't make me cry. But I had a nephew commit suicide. No, still emotional after all these years. But everybody has such an emotional story. Now, we can either say, okay, we have this emotion, there's nothing to do about it, or we can say we're going to attempt to do something about it. And I'd like to think that which I'm doing with Senator Murphy and Congress is participating in, creating the resources for locals and states to do something positive means that those stories will be different. That the person who, if her needs are unattended to, spirals downward, instead has her needs attended to, and that first episode of serious mental illness is her last episode. If we can do that, we succeed.
Do you think that that could have saved your nephew's life?
Well, we'll never know, right? And he had a lot of good service. So we attempt to do things for people, but we can't know for sure. But there is someone out there that the data shows will be helped. This is what we're doing is based on something done in Maine, in which they took folks who had their first episode of serious mental illness as an adolescent or young adult, and again, wrapped those services around that person, and they found they could make a difference. And again, instead of serial breakdowns leading to a death and being found beneath a interstate overpass, the person was returned to wholeness, and it became a distant memory, not a life-defining event. And if we can do that, then it's great for the person, the family, and our society.
My uncle died by suicide. He had mental health issues, so it's hit me personally as well. And it really changed my perspective on the importance of mental health. Did your nephew dying by suicide change your perspective? And if you don't mind me asking, when did that happen?
Well, that was about 20 years ago, even longer. I'm a physician, and I worked in a hospital for the uninsured. So I think I always had a group of patients who are more vulnerable. Now, patients in general, by definition almost, are vulnerable. But my practice of liver disease dealt with a lot of folks who had alcohol problems or drug problems. Not all, but some. And there's oftentimes a co-diagnosis. There's the person who has this addiction, but the addiction in a way is attempting to compensate for the mental illness.
It's interesting because mental health is often separated from physical health. Why is it so important for mental health and physical health to be treated in tandem?
Well, there's an occasional medical condition in which the physical condition brings about the mental health issue. So we can have that kind of small subset. But when you look at people with serious mental illness, the longevity is much less than the general population, much less. Put differently, they're more likely to die at an early age. And so having serious mental illness often leads to serious physical illness. Now, we spoke about the people who treat themselves with addiction, cigarettes or alcohol or drugs, but it's also an inability or a difficult in keeping up with follow-up healthcare visits. And then sometimes it's our dadgum payment laws. Prior to the bill that Chris and I wrote, and others in another bill we worked on, Medicaid would not pay for someone to see their family doctor, for example, and their mental health doctor the same day. So the internist could see that the patient is wildly psychotic, but couldn't send him across the hall to see the psychiatrist because Medicaid wouldn't pay for 2 doctor visits. Similarly, the psychiatrist could see the person and just diagnose him as being dehydrated from diabetes out of control, but could not send him over to the internist in order to have their diabetes addressed. They have to send them to the emergency room with all the barriers that it's involved with. So it's also our payment system that has worked against people getting the care they need.
I want to talk a little bit more about that bill with Senator Murphy, that you've been working on the Mental Health Reform Reauthorization Act. Do you feel as though members of your party support this enough for it to pass? Do they understand the urgency of this? How do you convince them this is not government overreach?
Well, so this is a reauthorization of a bill we passed in 2016, the Mental Health Reform Act of 2016. At that time called the most significant reform of mental health laws in 30 years. So this is not out of whole piece.
It expired in September.
It expires in September.
Yes.
And of course our bill attempts to take it and refine it, what went right, what went wrong, try and make it better. Now, whether or not it's passed at the end of the year, I can't tell you that. There's a lot of stuff trying to come together in an end of the year package. If not, we'll reauthorize it again this coming year, try and get the dollars put out there for the state and local programs to continue. I think everyone agrees upon the urgency. It's probably just the overall kind of sheer volume of business that Congress has to get done, number one. And number two, in the response to the shooting in Uvalde, we passed a whole lot of other mental health legislation. And so it may just be, okay, we've spent a lot of time and energy upon this set of mental health proposals. We have to let other things work their way through the system before we return to mental health again.